So good afternoon, everyone. My name is Kate Uhlman, and I'm a medical student in my final year here at McMaster. The project that I am presenting today is called Routine Pathological Examination of Clinically Presumed Dupuytren's Disease. Does it add value? And this is a project that I worked on under the supervision of Dr. Tomac. So first, none of our authors have any disclosures to make, no conflicts of interest. So what is Dupuytren's disease? Well, Dupuytren's disease is a fibroproliferative disorder of the hand. So what happens is individuals that have Dupuytren's disease have really thick tissue along their palm, which results in their finger or fingers to have a contracture. So that means that they're bent and unable to be extended. And this often leads to surgical management. And in surgery for Dupuytren's disease, what happens routinely is that tissue specimens obtained in surgery are sent for pathological examination. And our group wanted to know, is this practice necessary and does it provide value? And value in this case is defined as improvement of health outcomes over costs. Previous studies have suggested against the routine pathological evaluation of other tissue types. So this includes things like hernias, intervertebral discs, gallbladders, knee replacements, but we'll use tonsils as an example to highlight this. So currently, and in the past, when tonsils are removed, they are sent for pathological evaluation to confirm the diagnosis. And what a study has done in the past is a previous study looked at 2,000 cases of children who underwent tonsillectomies. And it showed that the practice of looking at the tonsils under the microscope didn't add any value. So in other words, it didn't change the medical or future management of the patients. And so why do we care? Why look at this? Well, our healthcare spending has outpaced our economic growth as a country in Canada over the past 20 years when we're looking at the rates year over year. So GDP, that represents our economic growth as a country, and the other graph is the current expenditure on health. And if this doesn't paint a picture, then we can look at the United States where this is even more pronounced. So as you can see in the United States, their healthcare spending has increased year over year at an average of 5.6% over the past 20 years, whereas their GDP has only increased on average of 3.9%. And so what you can see is that a gap is being created where economic growth in North America isn't at pace with the healthcare spending. And this is likely to become even more of a challenge in future years as our aging population takes place and as well as the COVID-19 pandemic continues to unfold. There's pressures on our healthcare system. So we need to, all of us in healthcare, whether that's healthcare practitioners or administrators, need to look at ways where we can improve healthcare efficiencies and decrease waste in our healthcare system. Which brings us to the purpose of this study. So the purpose of this study was to determine the rate of discordant diagnoses, the value of and costs associated with routine pathological analysis of palmar fascia tissue extracted in surgery for clinically diagnosed Dupuytren's disease. Our research question was, does the routine pathological examination of palmar fascia specimens provide value? And this research question can best be addressed through a retrospective study design. So a retrospective study took place for the time period between 2001 and 2020, so a 20-year period. First, research ethics board approval was obtained. Our inclusion criteria for this study was surgery for patients with a preoperative clinical diagnosis of Dupuytren's disease, where the surgery took place at St. Joseph's here in Hamilton. Exclusion criteria included individuals under the age of 18, miscoded procedures, cases in which no extracted tissue was actually sent to pathology, and a diagnosis of rheumatoid arthritis because that can impact the pathology results. Our primary outcome of the study was percentage of concordant, discrepant, and discordant diagnoses. Concordant was defined as when the pathology diagnosis confirmed the clinical diagnosis of Dupuytren's disease. Discrepant was when the pathology diagnosis differed from the preoperative diagnosis of Dupuytren's disease, but no change in management was required. So otherwise, these were benign findings that didn't impact the management of the patient. And discordant finally was when the pathology diagnosis differed from the preoperative diagnosis of Dupuytren's disease and a change in management was required. So this would be things like malignant findings or anything that would change the course of management of the patient. Our secondary outcomes included the anatomic location of the tissue specimen and costs. Our sample size was calculated prior with the help of our biostatistician who was on the study with us, and that was calculated to be 500. And this was based on an assumption based on the clinical expertise from Dr. Thoma and Dr. Bonnard, who was the pathologist on our team, that the occurrence of a discrepant diagnosis would be rare. So in other words, under 1%. For costs, these were calculated based on the Ontario Schedule of Benefits, and this was done by adding up the laboratory processing fees, the pathologist fees, and the ancillary testing fees. So moving to our results, overall, we had 1,323 pathology reports included in the study. This encompassed 1,480 palmar fascia specimens, and it was from 1,078 patients. By diagnosis, 96.1% were concordant. So this meant, again, that the pathology diagnosis confirmed the clinical diagnosis of Dupuytren's disease. 3.9% were discrepant. So this included things like scarring or other benign findings that did not change the management of the patients. And finally, and most importantly, there were 0 cases of discordant diagnoses found in the 20-year period. In terms of location, one of our secondary outcomes, it was found that the most common location of the tissue specimen was from the 4th digit, and this was representative of prior studies of Dupuytren's cases. For costs, the average cost per specimen was $34.57. This resulted in a 20-year cumulative total of over $51,000 and a yearly average of just over $2,500. So there has been an increasing movement in North America towards looking at ways that we can improve efficiencies within our healthcare system and decrease waste wherever possible. So this can be seen in initiatives such as the Choosing Wisely campaign. And recently, there's also been movement towards looking at certain routine practices that often take place in our healthcare system. So this includes things like routine pathological evaluation of certain tissue types. There was a recent study in Nova Scotia that made 34 tissue types exempt, and it found that over a 2-year period, the total number of analyzed tissue specimens in the province decreased on average by 10%. And this is important because not only does that reduce waste in our system and improve the healthcare spending, but it also creates room for more critical pathological analyses to take place faster, so to limit the wait times between when something is being processed for a pathological analysis. It is important to note, however, on the other side of things, that pathology findings can be used as a quality check in our system. And what I mean by that is it can often confirm clinical diagnoses, and through that, it can prevent unnecessary procedures or surgeries from being performed. Some limitations of our study included the retrospective study design. Also, there was missing clinical history in 165 cases, and cost estimates really truly were limited in this case because there was a lack of availability of microcosting within the pathology lab, and it would be beneficial in the future for a full cost analysis to be performed if microcosting became available in the future. In conclusion, the study found 0 cases of discordant diagnoses over the 20-year period, and therefore the practice of routine pathological examination for clinically diagnosed Dupuytren's disease does not provide value, and we should really consider abandoning this practice. Thank you very much, and I'm happy to answer questions.